Please tell us about yourself.
Namaskar, Vande Matram. Myself, Dr. Chandan Kumar, Chairman cum CMO of the Vinayak Hospital and Research Center Group, headquarter branch Ranchi, and we are expanding it in Bihar and Jharkhand and Uttar Pradesh, and we have a plan to expand it across India. My father is Mr. K.K. Singh. He is a retired chief engineer from Jharkhand State Electricity Board, as well as my mother is the senior advocate at Jharkhand High Court. My wife is a government prosecutor in Jharkhand High Court, and my younger brother is a software engineer as a senior consultant in Tata Consultancy Services in Gurgaon.
Journey of the Vinayak Hospital and Research Center Group, and how you started first Vinayak Hospital and Research Center headquarter branch in Ranchi. What was the driving force behind that to start a multi-speciality hospital with all latest technologies?
After completing my MBBS and internship in 2012 from Rajiv Gandhi University, Bangalore, I came to Ranchi, and I found that there are very few healthcare providers which are giving very nice and state-of-art treatment to the tribal populations of Jharkhand. So that made me to start the Vinayak Hospital and Research Center, its first branch in Ranchi, headquarter branch. It's a 55-bedded hospital. It was started in 2012 when I was very young at that time, just completed my MBBS, but I had God-gifted courage to start that, and we established this. And we are also associated with the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. And before that also, we were doing all the philanthropic kind of job for the poor tribal population and the population who are living in jungles to provide the best state-of-art treatment, which is essential human right for every individual. So I started the Vinayak Hospital and Research Center in 2012. After completing my MBBS from Rajiv Gandhi University, Bangalore, I got the transfer of my internship in Rajendra Institute of Medical Science, which is also a state-of-art medical college in the eastern India and all over India. And there I found that the patients are in the neurosurgery department, they are not dying from basically from the neuro injury, but because of the consolidation which are occurring in the chest after a long stay in the bed due to gravitational force, the lungs are getting affected. So that time I thought the most of the deaths are not occurring for the cause of neuro injury and brain injury or neurosurgery. Most of the deaths were occurring from pneumonia. So that time I thought that why not to give such medication that directly goes to the lungs, and that will help the patient to recover from pneumonia. And I started the research work on that, and I did the research work in the Rajendra Institute of Medical Science as well as in the Vinayak Hospital and Research Center using inhaled antibiotics because the penetration IV antibiotics were just 30 to 35% to the lung parenchyma, but if we were giving it through inhaled form, it was more than 78% penetration was there in the lungs parenchyma, and we found that the mortality rate drastically reduced. So we published it in various journals and national and international journals and got recognition for that. The introduction of inhaled antibiotic came, and further during the time of COVID, it was found that this research work helped a lot, just not in our country but across the world, by using inhaled antiviral drugs and antibiotics to prevent the patient from consolidation of the lung and pneumonia, and it drastically dropped the mortality rate. and patients were getting lots of benefit from it all across the world. And it has been named the Dr. Chandan Kumar method of therapy with inhaled antibiotics and many various prestigious international and national journals.
Your journey from the Vinayaka Hospital and Research Center to PMO India, the highest office of India.
Yes, certainly it's a good question. Actually, I was working in my headquarter branch, Vinayaka Hospital, Ranchi, during the demonetization time. As the demonetization occurred, all the private hospitals closed their OPDs, and most of the government hospitals also were not accepting the 500 notes. The main duty of the doctor is to save the life of the patient, not earning the money. So there is no limit of more and more and more. So immediately, as a power vested in me as the chairman of the Vinayaka Hospital Research Center Group, I said that there will be 2-month free treatment for all the patients who are coming to the Vinayaka Hospital and Research Center, and including drugs, medicine, ICU charge and laboratory charge, blood investigations, and even blood transfusions to our volunteers of Bharatiya Janata Party Yuva Morcha. And I don't know how it got viral across the nation, and I got the title of Angels of Demonetization. Immediately after that, Prime Minister Sir had the telephonic conversation with me, and he said that I wanted to meet you. In 2017, January, he called me to his office, South Block, New Delhi, Prime Minister's office, and he offered me the post of board member of National E-Governance. And I deliberately, for the sake of the nation and working for the nation, I accepted it. And since then, I am the board member of Prime Minister's office, South Block, New Delhi.
How are you feeling after getting honored by Honorary FRCP, FRCS, and FRCMA?
It's a wonderful experience to get such an honorary, getting a Fellowship of Researchers of Commonwealth Medical Association, as well as Fellowship of Royal College of Physicians and Fellowship of Royal College of Surgeons, all thrice together. It's a wonderful experience, and I thanks to Dr. Jayalal and my junior colleague and my brother, Dr. Venkatesh Katyayan, who nominated me for that. I also thanks to the Royal Society of England and King Charles and all the members of the Commonwealth countries for giving me such an honor, and it's a very delightful moment for me now.
Tell me briefly about Ayushman Bharat Pradhan Mantri Jan Arogya Yojana and its significance on common population of India.
I'm really thankful to God, Shri Mahakal and Mata Rani, as I am their devotee. That such kind of thought came in my mind for the philanthropic and free treatment of the poor and BPL population of India. In a meeting, I said that to the Prime Minister that we can have such scheme for BPL population for providing free treatments up to 5 lakh rupees, and he gave me free hand to design it, and I became one of the designing board member of the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. Now we can see that millions and millions of people across the nation is getting free of cost treatment up to rupees 5 lakhs with hassle free. And for our hospital, I initiated one more innovative thing, that we established Common Service Center, and we were the first hospital to start the Common Service Center in its campus only, so that if there is any need of name correction or in the Aadhaar card or ration card, that can be done hassle-free inside the hospital. They don't have to go to the block office or any district office. They can get it done in the hospital itself with no time loss, and the patients are getting hassle-free treatments across the nation. and hassle-free treatment in the Vinayaka Hospital and Research Center group. And I appeal to all the hospital to start this innovative thing, CSC inside the campus of the hospital, which will help the patient to get the hassle-free treatment for Ayushman Bharat Pradhan Mantri Jan Arogya Yojana.
Tell us something about your 3 world record established in the field of medical science. Being a world-famous doctor and a renowned medical scientist across the world, an innovator in the field of medical science, why you joined BJP and since when?
Oh, really, it's a very significant question you asked, and I'm glad to answer that. For the doctor fraternity, first of all, a doctor must be a leader, and a scientist must be a leader. As you said that you're a world-famous doctor and a world-famous scientist in the field of medical science, so there must be a quality of leadership in a doctor so that to handle all the case in a very courageous manner. As we see, our B.C. Roy sir, his name, we celebrate Doctors' Day at the time of independence. It was then FRCP and FRCS from London. And he also treated Gandhiji, and when he was in Yarwada jail, he was the first chief minister for the West Bengal. For the 16 years he served, and he just gave a few hours for his patients also. When I was in college, since then I was in Akhil Bharatiya Vidyarthi Parishad, and I was the state president for the Akhil Bharatiya Vidyarthi Parishad Karnataka in the year of 2010 and 11. After coming to Ranchi, I joined Bharatiya Janata Party main wing, and it helps me to understand. I can go to the village to know what is the things going on and how we can solve the problems. Just treating a doctor in operation theatre or sitting in an AC room, that's what inspired me, and that is the leadership quality. Since my student time from ABVP, Akhil Bharatiya Vidyarthi Parishad, president of Karnataka, and now as a member of Bharatiya Janata Party. And I will also encourage the doctors to come in the field, because they are intellectual, to come in the field of politics also, so that we can understand the real pain of the people by visiting villages and villages with the party workers and know the real problem and how we can solve it, and how we can do necessary changes in our health system, and changes in the Pradhan Mantri Jan Arogya, Ayushman Bharat Pradhan Mantri Jan Arogya Yojana to get the best result. I have a quote that Swasth Bharat, Samriddh Bharat. First it will be the Swasth Bharat, then it will be the Samriddh Bharat, then it will be the Sasakt Bharat. Yeah. So Swasth Bharat is very necessary. I encourage all the doctors, fraternity, to give some time to the politics, and good politics. Thank you.